Covering your health here on First at 4. This month marks 5 years since the start of the COVID-19 pandemic here in Louisiana and across America.
These years later, some patients are still struggling with persistent health problems, what we know as long COVID. News 15's medical editor, Dr. John Lepre, explains.
It's the 5th anniversary of the COVID pandemic, and I want to talk about long COVID. We've learned so much about this condition. Long COVID patients can have symptoms that last for months, long after the virus has been eliminated. Symptoms include fatigue or decreased endurance, shortness of breath, loss of taste, thinking difficulty or brain fog, and even depression. We know now that the initial COVID infection does not have to be severe. In fact, 30% had only mild initial symptoms. Now let's look closer at the physiology of long COVID. COVID can attack any organ in the body, but prefers the heart, lungs, and brain. The area of attack first becomes inflamed, and these inflammatory molecules direct the immune response. However, while the virus is eliminated in the process, residual inflammation is like a smoldering fire, causing ongoing damage. So these long COVID symptoms are a result of this smoldering attack on these organs. Inflammation of the heart limits exercise and endurance. The lung causes chronic shortness of breath, and the brain gives a confusion and brain fog. Now, the actual breakthrough is recognizing the specific pattern of inflammatory molecules, and this is proving helpful in predicting these patients. Further research indicates about 1/3 have at least one long COVID symptom. As of yet, there's no specific treatment, but fortunately most recover within a few months. Reporting on your health, Dr. John Lepre, News 15.